Hey, good afternoon, everybody. This is Eric with American Business Systems. I welcome you here to an exciting afternoon. We're going to be talking with Cheryl Carr. Adam and I have had the privilege of talking with her just a little bit before we got started with you and bringing everybody on. And folks, you are going to be treated well this afternoon. I think you're going to really enjoy hearing about Cheryl and her journey into what she's doing. Maybe she'll share a little bit about her personal life and why she's doing what she's doing, because I think it'll help, with the story there line. And she can share obviously just what she wants, but I think it's, coming out of corporate world and being able to work from home and then having the flexibility that we all want is the whole reason why we're looking at opportunities like this. So for those that are on here, I see Amit and Carla and Chad, Dominico, Donald. Good to see everybody here. I'm going to be asking you to kind of tell me where you live here in just a moment. Trey Thibodeau. Okay, good occasion name there. I see that one there too. But in just a moment, I'm going to share with you where you can put in the Q&A box, because you're going to want to ask questions as we go through the webinar this afternoon. And folks, again, just kind of sit back, listen. Again, if you've got specific questions that you want to chat with us about, feel free to put that in the Q&A box. But today we're going to be interviewing one of our new medical billing business owners, and that's Cheryl Carr. I think she started sometime at the end of last year. So you'll see how quickly you can get started, because I know a lot of you always ask that question: how long does it take to get your first client? And hopefully we'll be able to chat a little bit about that. If this is your first time on any of our webinars, let me introduce myself, and I'm going to introduce the company and our CEO. So my name is Eric Auger. I'm the Director of Learning and Engagement. Obviously, this is why I'm here helping you with the webinar and everything this afternoon. And if you'll find a place over here where you can put your questions, here's that Q&A box. Some of you have already answered in there that we've got Carla from Gilbert, Arizona. We've got Chad from Louisville, Kentucky. We've got Mule from Houston. Good to have you. Joshua from Chicago. Thanks, everybody, for piping in there. Keep putting that in there. We're going to keep looking at that as we go through the presentation. But now that I've introduced myself and a little bit about American Business System, let me introduce you to our CEO, Adam Phillips. He's going to be joining us this afternoon. He's going to be leading out in most of the interview process with Cheryl. And I'll be watching and queuing up the questions as they come in for this afternoon as your questions come in. But Adam's been our CEO for quite some time now. He is following in his dad's footsteps in a lot of ways, of which he has written some books. Adam has a book out by Dr. Vicki Rackner and himself called 9 Ways Doctors Let Money Slip Through Their Fingers. He is also a contributing article writer for an article, a billing and coding magazine called Billing and Coding Magazine, in which he presents several articles throughout the year, and they end up posting them. And the last few ones that have made it to the production is he did one called The Shrinking Private Practice, Why Billing Expertise Can Be a Lifeline for Doctors. That one is very good. He wrote one back early on at the onset of artificial intelligence. Will AI take over my job as a medical biller or coder? You're going to want to get a hold of those articles. Now, let me tell you how to do that real quickly before I keep introducing Adam. If you will, just jot this note down, get back with your sales rep, ask them for the PDFs of those 2 articles. They will send those to you. They're not on our website anywhere, so you're going to have to request those if you want to take and get a read on those. And you're going to want to read the one that Adam wrote back in 2024. Adam is also the founder of an organization called MERMA. This is the Medical Revenue Management Association of America. This organization's been around for nearly 10 years now. Dr. Rackner is also our medical director that's on the board of directors there. And you will want to be a part of this, because I'll tell you how to be a part of it. Once you become part of American Business Systems, like Cheryl is, and she's gone through her training, then you're part of this organization here called MERMA. It is the one of the largest independent group of medical billers in the country, and it is also this organization that will certify you as a certified medical revenue manager. That means you'll be able to keep your CMRM title behind your name, and you can share everybody that you got that from MIRMA, and there it's recognizable out there on the internet, and so you'll be able to share that with your doctors that you're looking at marketing to, and then hopefully be able to do the billing just like Cheryl's doing her billing. Well, folks, without any further ado, let me bring on Adam first. Adam is going to help kind of walk us along here. Adam, it's good to see you.
Hey, good to see you, Eric. Thanks for having
Yeah.
me on. I'm really excited to chat with Cheryl today.
Yeah, absolutely. And then let's go ahead and bring Cheryl on. Cheryl, let's go ahead and bring you on. Good afternoon, Cheryl. How are you?
Hi, how are you?
Thank you. Thank you for joining us. Adam, let's get this thing kicked off this afternoon.
Sure.
Yeah, thanks a lot, Eric and Cheryl. Again, really happy that you took time out of your busy day to be on this. We were chatting earlier. You were telling us that you watched several of these webinars yourself before you decided to join us. Yeah, so I know that most people that end up joining ABS, they do end up watching, 3 or 4 or 5 or sometimes 100 of these webinars before they make a decision. So thanks for doing that. This is kind of a special one. We have a whole bunch of prospective ABS owners that have not made the decision yet that have joined us today. And we also have existing ABS owners that have joined us and just are here to hear your story. And anybody on here that wants to ask Cheryl questions about her business, feel free to start typing those in. I would rather, read questions from the audience than just read off my questions that I've got. So, so anything you can think of that you want to know. But why don't we go ahead and start by you just telling us, let's take it all the way to the beginning. Like, give us a bit of information about what inspired you to start your own billing business, and what were you doing before? Were you in healthcare? Were you in billing before? Kind of give us a little background of how this all got started.
Sure. Thank you so much for having me. I worked in healthcare, yes, corporately, but nothing to do with billing at all. I knew nothing about CPT codes or what was required of billing. My role was mostly in operations and mostly for companies. We were searching for hospitals that wanted to participate in the Be the Match program or some sort of donation program for their blood services. So yes, I was accustomed to going into the hospitals, meeting with the doctors, but it was more so about the forms that needed to be completed when they had a donation, compliance wise,
Mm.
talking to the staff, making sure they had the tools that they needed to perform the donation, but nothing, to this degree of healthcare. I onboarded our staff, made sure they completed training. I did some credentialing with the hospital systems through their like diversity supplier program. And so I was
Mhm.
accustomed to making sure everyone was up to date on their education, their licenses, insurance requirements, things of that nature. But I knew nothing about medical billing. I knew that healthcare was a great industry to be in, and I knew that I wanted to be an entrepreneur, but it was not until I started, really researching what it was that I could be excited about, something that I
Mhm.
could see as a future. I looked at a lot of different franchises, but the ones where I could work from home were really the most important to me because I do have 2 small children.
Yeah.
And with my corporate job, I spent hours in the car every day. And so I did not want to take that on. I wanted something that I could work from home,
Yeah, you were
knowing that I
saying that you
would
drive a
still work
long
a
you
lot.
you
Say that
drive a
again.
I was going to say you were telling us you used to drive a long way.
Yeah. And the mileage was only 24 miles, but it took me an hour and a half in the morning. And that was after the 30-minute window of dropping off my children. And then
Mm.
coming home was about an hour and 45, maybe 2 hours with traffic. If it was raining, I I cried. When I got in the car, I just cried because it would take forever to get home and then still need to come home and take care of what's needed at home. It was just, I loved my job. I loved the work. I loved the people I worked with. All of that was beautiful. But the
Yeah.
drive was just taking too much of my time. That was literally 3.5 to 4 hours a day
Yeah.
that I was in the car. So I needed
Wow.
something to change that.
And how long were you working in that corporate job?
At that job, 4 years, in that industry, about 12 years. And the
Oh,
industry, I drove like that the entire time. I'm
yeah.
in Metro Atlanta. Atlanta is very spread out. It's not that you're driving many miles, but there's a lot of traffic.
Sure.
Yeah.
Well, you've been in the healthcare industry, and healthcare, and a lot of people think uh, if you've been in healthcare, gosh, you probably already have doctors lined up. But the healthcare industry is so segregated in so many different
Mhm,
specialties. If you can think about it,
mhm,
so just because you've been in a healthcare background doesn't make you a specialist of getting doctors or get
mhm,
started here with medical billing. So
mhm. Not to
obviously,
this
people
point.
always
I
ask
mean,
that.
I will reach out to
Yeah,
them. And most of my doctors at time were women's health, which I don't have any women's health providers right now. So my clients have not come from my background. My clients have come from literally telling everyone that I know this is what I'm doing now.
yeah.
Yeah. Would you say your skill set was more sales, or was it more just you were felt more like a consultant, or what's your skill set?
Probably a little both.
Yeah.
Um, Sales has a bad connotation, so I never like to say sales.
Yeah. No,
Were
no,
you
it's
cold
good.
Um,
calling? Were you cold calling on people?
No.
Did-
Well, I
no.
did a little bit. Yes, I
A little bit
did.
of that.
I did.
Mm.
Or warm leads. I would attend trade shows and have like 2 minutes to talk to someone.
Right.
Yeah.
Or when I was actually working in the hospitals with say the patients who would be making donations. Yes, you have about 30 seconds to tell them what your service is.
Right.
I still don't consider that sales. You tell them how you're able to help or what the opportunity is and go from there.
Yeah. I want to get into the marketing methods and stuff, but so tell me, so you had no experience in billing, no experience in revenue cycle management. What kind of pushed you that direction? Like you just, how did you understand that there was a need for that and a good market to be in? You know what I mean?
I mean, it's good and bad.
Yeah.
Unfortunately, every time I went to the hospital or went to a doctor's office, it was full. I mean,
Hmm.
there's a need for healthcare. So I knew I wanted to be in the industry, not consider other industries, but most of them involve like brick and mortars, and I didn't want that type of overhead. I needed something that I could be from home and that I thought had a future as
Yeah.
far as a business. And um, I knew that I'm a customer service person. Like I don't have any billing experience, but I never tout myself in my proposals as a biller. It's very clear that I have an understanding of the industry, but that I am the CEO of my company. And basically,
There
when
you
you
go.
hire me, you get two levels of oversight. You have the person with the expertise, with the billing and the coding and the compliance, but then you have me making sure that all of that is done properly. Now, since I've been in the business, I'm picking up on some. I recognize codes. I know how to go in and look to see if the payers answered, if the clearinghouse rejected, and like all of that because of the reporting. But I knew as long as I could be honest that, hey, I'm not the biller, but I am going to give you the best service that you've ever had. I'm going to try my best. And if I don't have an answer, I'll get the
There
answer.
you go.
And people
So
appreciate
you so you
that
you
honesty.
understood right out of the gate that it's all about positioning, how you position yourself and letting people know that it's not just little old me working out of my house. It's I am the owner of this business. And you and I talked just a minute ago about I have people. I have people that help me and people that know more about coding and everything than I do. And that's true for any of our owners that go through training. I mean, they can lean on our support team as they're
Yeah.
building their business for help with any kind of technical thing that they don't understand at that moment. So that's what we're there for. So that was going to be my next question. So you started to go online and look at franchise websites and stuff, and you were looking at all kinds of different industries, healthcare and other things. What were some of the real main points that stuck out that were like, okay, ABS is something that makes a lot of sense for what I'm looking for? Do you remember you like why we
Yeah,
stuck out?
so I mean, just to be honest, the earning potential. I mean, I'm leaving a very good corporate job, so I need to make sure that I'm able to make a living with it. Understanding it may not happen immediately, but there
Yeah.
is potential there because some of the other franchises they cost the same, if not more. But I just felt like the return was going to come like almost in just so small of increments that just was not appealing to me.
Yeah.
And then once I understood the training and I was able to see, okay, implementation fees, monthly fees, like add-on services, it was very clear to me that it was an opportunity to make a good living. The fact that I could do it at home, the fact that, I mean, wishful thinking, 10, 15, 20 years from now, if my daughter wants to take over because like I have
Sure.
my all that on the contract, like I wanted something that if they wanted to take over the business, they could.
Yeah.
Um, all of
And
that was very important to me.
and probably the no territories and no royalty fees
Oh, of
helps as
course. Yeah,
well.
that goes without saying. Like, I don't want you to tell me that I can only be in Georgia or I can only be in this zip code. No,
Yeah.
I I love the fact, and right now my clients are here in the metro area, two of which I've met. One, she's a little bit outside of metro, and I have not met her. It's all been virtual, but
Uh-huh.
this is what I've been able to do literally in just a few months. Like, I don't want to say with little effort, but I haven't even begin to tap into like the marketing plan that I have for the business. I'm just still in the early stages of it. Just the networking has brought, the clients to me. But the fact that if I have a client in Washington State, that's pretty exciting that that might happen for me one day.
Yeah, I tell
Awesome.
people that all the time because there's occasionally somebody is worried about, oh, well, are there going to be other people in my area? I'm like, there's medical billing companies in every city. And if you do a Google search, you're going to find a ton of medical billing companies. But what you'll find is people that they don't know what they're doing. They don't have a full suite of revenue cycle services like what you have. They've put together some crummy looking marketing materials and, a website maybe, and so you can very easily set yourself apart by all the materials that we put together for you, the flyers and books and the website, nice looking website and all that stuff. So you can pretty easily, set yourself apart. But yeah, I mean, the thing is once you get your first couple of clients, which you've already done, and we talked about this a minute ago, you're going to start getting referrals from those existing clients and other referral partners. And they can be any medical provider anywhere in the United States that you can sign up, like you said. So
Yeah.
much, much better model, in my opinion. Yeah.
Yeah. And
Hey,
to
Adam, there's a
the clients
oh
that I have, they're actually happy that I'm a small business because
yeah.
some of their previous billers were, huge companies. They felt like they were one in a portfolio of how many clients they didn't get good customer service, or they were had companies who were overseas and there were time zone differences and all of that. They're actually
Mhm.
happy that I am here and that it's a small company that I really have my eye on the pulse. They don't feel like they're lost. They like the service. So that's been a
That's
real
good.
point for me, a selling point for me.
Great. We do have a couple of questions that came in, but I
Yeah.
wanted to real quickly before we get into that, let's just talk a little bit more about the timeline as far as like when you went through training. So tell us when you went through the training, how long did it
Mhm.
take? And of course, the next question would be, how long did it take to get your first client
Sure,
after the
sure.
training?
I went into my training like right after Labor Day weekend. So if Labor Day was Monday, I think I started training on Tuesday, and my trainer was amazing, Cynthia. Again, I have a crazy schedule.
Yeah.
And so she worked with me on my schedule. I think I finished all my classes in less than 2 weeks.
This was
So just,
last year, right?
yes,
2025? Yeah. Okay.
mid-September 2025.
Okay.
Now, after I finished my classes, there was a 2 month delay that I did not do a thing.
Oh,
And that's because I was working. I have a child with special needs. He has autism. So if
hmm
you know anything about that, you know that's time consuming, that's therapy appointments and all of those
yeah.
things. And
Yeah.
then my daughter was diagnosed with a form of epilepsy. So that's doctor's appointments, all of that. She's going to be fine. Thankfully, it's one that she should outgrowing adolescence. Who knew that that was a thing? But
Oh, wow.
going through all of that, and then once they were well, I got sick. I had some kidney stones, and if you've ever had that, so there were
Yeah.
2 months that I did not do any work. Now, I
Yeah.
still read through my notes to just have a comfort level of what is this new business I'm in. I still went to every webinar as these. I still watch those. But as far as sending out any material, I don't even know if I told my friends that this is what I was doing yet. I didn't start that until the day after I was laid off from my job. I
Oh,
intended to
wow.
work this while I was still working. I thought, oh, I can do this for a year or two, build up my business. No, I was laid off, a reorganization in the middle of November.
That
And
was
the
one of my
day
questions. Yeah. So
after
when did
is
the
when
layoff happen?
say that again.
I'm
Could you
sorry, that
repeat
was one
that?
of my questions. So I was wondering if you were working while you were building the business. When did you get laid off?
So I was laid off mid-November. So when I finished my training
Oh,
Wow.
mid-September, there were 2 months where I just studied and was life issues. November, I don't know the exact date, but just let's say the 15th, I was laid off. That next day is when I really started working on the business because I thought,
Yeah.
oh, okay, well, I'm
Here
not going
you
to
go.
panic. This is why I invested in this business. Now I
yeah.
don't have any excuses to, take my time. And so that's when I really started like looking at the marketing material that you all had sent me, really looking at the book, highlighting the pages that you told me to highlight,
Yeah. Yep.
getting my electronic business card. I tweaked my website a little bit, with the providers that you guys recommended. That's when I started working mid-November. And that was literally sending out to my friends and family. I did not approach any doctors. It was all
Okay.
friends and family.
Yeah.
That was mid-November. I got my first lead 1 month later. A friend dropped my information in some group chat somewhere. We can't trace it back, but in a group chat where someone was talking about billing.
Okay.
And my client saw my information along with two or three others. She called me. We literally had an impromptu practice analysis on the phone right then and there.
Oh,
Yeah.
But
wow.
because I'm prepared, I said, oh my God, I had all my papers laid out in front of me while I was talking to her. So it wasn't to the T the way that it should be, but it was enough to
Sure.
like
Yeah.
capture some information. I was not going to tell this lady I can call her back tomorrow or the
Yeah.
next day. While I had her on the phone, I needed to
Yeah.
talk.
Absolutely.
Wow.
With the understanding I may have to call her back later, but she liked that. We had a good rapport. I actually met her in person New Year's Eve at around 12 o'clock. She was going to work half day. We met New Year's Eve. I went to her office and gave her my proposal at that time. She liked
Mhm.
it. She wanted to think over it just, a couple of days. And I think the 3rd or the 4th of January, she signed the contract. And that was my
Wow.
first.
Very good.
Wow. So about a month after you
About a
started.
month.
Yeah.
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 Wow.
And then a
Okay.
month after that came my second provider. Um, Same thing, talked to her on the phone a couple of times,
Was that another group
variations of
chat
a
thing, a
practice
mysterious
analysis.
group chat thing, or how did that one come about?
That one came from a friend who's a business owner, and he had done some services for this provider, and just said, "Hey, my friend, I don't even know what she does, but she helps doctors. Can you give her a call?" She's nice. She's not going to take your money. I trust her. Like, can you just talk to her? And turns out the provider was looking for a medical biller, had an ad on Indeed or LinkedIn or something looking for someone. She was not happy with who she had.
Yeah.
And we talked a couple of times. I actually went to the office, sat with the practice manager an hour or two to just get a better understanding of their business, see the system they were using, all of that, put together a proposal. And about a week later, she signed.
Do you think she was looking at other billing companies or?
Yes, definitely.
Yeah,
Because she was being approached a lot by overseas companies.
sure,
Yeah,
Um,
yeah,
sure.
and truthfully, their presentations look very good and flashy and have all the things, but she was looking for the customer service aspect.
yeah.
Mhm.
And she really wanted in-house biller. She wanted to hire someone.
Yeah,
But I convinced her I was the best of both worlds in that I treat the account as if I'm in-house, but you don't have to pay health insurance and workers' comp and like all those
hmm,
things that come with when
Yeah.
you have an employee.
hmm.
So she appreciated that I understood that. And so that's how I got her.
There you go.
I
And
tell
my third
people,
client
yeah,
was, how did I get them? Another friend, like sending out my electronic card to everyone. And this is my credentialing client. And I actually checked with a few other credentialers, got the pricing for her. But then as I was talking to her, I understood like her timeline and what she wanted to accomplish with her business. We built a rapport and I said, I can do this. So I started the credentialing.
Good
now
for
do you
Thanks to
want to
Jeff,
just
because
tell
I
people,
called help desk and asked like some information about credentialing, and Jeff walked me through all of that, talked about the specialties and what I should look out for and which payers, I should probably consider starting first with. And he said, Cheryl, you could do this if you want to. The way you're understanding what I'm telling you, I'm sure you can do it. At least try. And if you can't, you don't like it, then you can take another avenue. But I actually love that part. So I'm glad he recommended that.
yeah, you're talking about ABS support. Our support team recommended that
Yeah.
you could probably do it on your own because you're pretty sharp, and it turns out you can. So, you want to just real quickly, for those who don't know, just explain what credentialing is, like real quick, can you?
Yes, you're just letting the insurance payers know that you're ready to accept their clients. That's how I explain it in layman's terms. So you're providing their education, their licensing, all of their interns, externs, like that they have insurance, basically that they're CAQH, which you got that their profile is up to date, nothing is expired. Do they have basically are all of their requirements in order, and you have to be organized, and it's just submitting it through the portals and following up
Yeah.
that they received it. Is anything else needed? Each insurance payer has a different set of requirements. Well, there's a core that are pretty much the same, but then each provider may have something a little different versus the other. And basically, once you're credentialed, then it moves to contracting. And now that client is able to see clients and get reimbursed for, get paid for some of those services from that payer. So it's
Yeah,
They
so
exciting.
may
My client
they
is new, and so she's starting her business and she's very appreciative. She looks at me as I'm her partner. I'm helping her to
there you
start her
go.
business because she's stepping away from employment and will be able to see clients, under her own business.
yeah,
So
I was going to say, what was I going to say? Yeah, so going after brand new practices, people that are starting a new practice, that's an excellent service.
yeah,
For those of you that don't, we explained the credentialing thing for those of you on the webinar here, and Cheryl is a sharp person, and she was able to learn and do it. And basically, it's like collecting a bunch of information and filling out a bunch of forms, right? But we have a credentialing service that we can provide that for your clients. For those of you on this webinar that don't want to do the work, we have an option of, someone else can do that work and you just mark it up and make money on it without you having to do it. So, and I mean, really, the same goes for the billing. You can hire other people to do the billing, which we're about to talk about here in a minute. Did you have a question, Eric? Were you going to say
well,
something?
I was just wanting to say, for I think a lot of people would understand, for a doctor being credentialed with a certain insurance company, that means that they're going to be a network with that group, that insurance. So that's what that means. I mean, just on a good layman's term for those that may not understand really what credentialing is. So like with Cigna or United Healthcare, you want to be in that doctor wants to be in that network because United Healthcare has a whole bunch of patients. So that's what all this is. So hopefully I just want to make that
Yeah, we
that
have about
connection
a
there.
we have about a dozen services, that billing is just one of the services.
Yes.
So
Yeah.
that's really what helps set Cheryl and all of our business owners apart, is because they're able to do credentialing, they're
Sure.
able to do, coding, chart review. We have, remote patient monitoring. I mean, we have all kinds of things that you can offer to get your foot in the door with doctors, and some new things that we're working on that I'm excited to talk about later. But let's see. So Chad actually just asked that question. When did you get started? How quickly did you get your first client? So hopefully we got that answered for you, Chad. Let's see. Joshua says, is this a franchise, and how much is the franchise fee? Well, Joshua, it's very similar to a franchise in all of the ongoing training and support that you get. You actually get lifetime support. So that's another benefit to working with ABS. You don't have to pay extra for it. It's a one-time fee for the entire business and all the training and materials. It's $35,000. That does have to be paid up front in full before you start.
But there are no franchise fees.
Yeah, not necessarily, no franchise fees other than the upfront, one-time investment, no royalty fees, no territories like we mentioned. All right, so Donnell had a question. You may not even be marketing in this way, but Donnell says, how did you get through to speak to the office managers and owners to share what you do? Are you going in cold to offices? Are you trying to get in touch with the office managers, the doctors?
I just started that. Yeah, because I did that for my previous role. And they're accustomed to having people walk in the office to sell their services. So I knew not to be nervous. You just walk in or call and see if the front desk will give you a contact email or, whatever it is. They're accustomed to it. The provider wants whatever services are available to make their lives better. So
Mhm.
they're not offended when you walk in and want to give them their material or take the practice manager's business card. Now you may have to call several times, or, I haven't gotten to that stage, stop by several times. I'm going to start using the e-cards that we have to thank them for, speaking with me today, or get my CRM together. I know we have the Zoho product. You have to follow up repeatedly sometimes, but
Mm-hmm.
making office visits is kind of, I don't want to say the norm, because I don't know if everybody else is doing that, but it's understood and expected. No one's offended when you walk in and want to leave your services. In fact, I think it's a good impression because they know you're taking your business seriously and you're not just waiting on the leads to come in. You are actively out presenting yourself to the public. So
And the key thing is how you present yourself, and specifically what you say when you're going in there, because
Yeah.
there are a lot of medical billers that'll just walk in and have a brochure and, hey, can you give this to the doctor? I do medical billing, and they walk out and that brochure goes right in the trash. So we have, I don't know if you just mentioned this, but we have various books written on revenue cycle and billing that you can give as a free gift to the doctor, different things to get into the doctor's hands. Now let me ask you this. Do you ever bring food?
So I'm just starting that. Because honestly speaking, again, I was laid off. So I was doing this just on the income that I have coming in from the business. So I do have the contact for the brownies. I'm going to do some of the edible arrangements because fruit is healthy. But yes, and from my experience, corporately, people like that you bring food. They
Yeah.
remember, they feel like that's a generous gesture.
Oh yeah.
You're not just asking, you're actually giving something of
Sure.
value. So I haven't done that yet, but it is literally on my to-do list because again, a lot of times you go to a medical complex, there's 3 or 4 offices in that complex. So I'm
Yeah.
just been in the preparing stage, but that's next on my list. Now that I have more, yes, that's it. That's it.
You know about Fairy Tale?
Maybe you emailed it to me or someone told me about it, because that's how I know it. That's the branded brownies,
Yes.
correct? Yeah.
Yes. So we are about to do a partnership with them where you can order at a discount. So get with me before you order, and I'll give you a discount code. Yeah.
Thank you, thank you, thank you,
Yeah.
thank you.
They've got a bunch of new stuff. They've got some new tins that are a little bit smaller that you can put your logo on there, and all kinds of different flavors of brownies. And of course, I had to order it and test the flavors. So they're all delicious. They have gluten-free ones and regular ones and cookies. And you're right. Good idea doing the fruit as well for healthy people. I don't know, but yeah. So anyway, we're going to be doing a licensee ABS owner webinar with the Brownie lady to talk about how to market with those. So, but I interviewed. I'm actually going to be interviewing another business owner, Opie. I don't know if you know her, but she's the one that gave me this contact, and she's gotten 2 clients so far just from sending the brownies. So
Wow.
it's
Wow.
pretty cool. Pretty cool. Yeah.
Yes, I'm excited.
Got some questions there, Eric?
Yeah, we sure do. Chad's asking, Cheryl, have you done any networking groups like BNI?
So I've just I haven't done it yet, but I have downloaded the locations. I'm in a very populated area, and there's
Yeah,
thankfully like 3 or 4 meeting groups around my area. I'm putting them on my calendar now because one is like Monday at 10 a.m. and another is Tuesday at 2 a.m. And you're allowed to do 2 or 3 meetings without even like paying a membership fee or anything like that. You can just pop in
correct.
and they have the opportunity where you can stand up and talk about your business. And even if you aren't able to do that, there's still just general networking at the beginning and end of the meeting. And so now that I have some of my merchandise, like I have ink pens, of course, my business card, I'm going to take my books. I needed to prepare for that. But yes, so that was one. And then the other was like just some local chamber of commerce type events.
Yeah,
That's going to be my second choice.
Yep.
After I visit the 3 or 4 meeting locations. Then I'll move to the Chamber of Commerce. I
yeah,
want. I honestly just haven't had the opportunity because in
sure.
3 months, just getting a grip on my clients, what their need is, getting even a better understanding of the billing, managing my team, and now that I feel like okay, that's stable. Like now I'm ready. I need more clients. So the networking is it, which is why I talked about the brownies, the networking, the meetings. That's literally what's on my agenda for the next month.
Very good. And
Now
then
you're
Dominic, oh, go ahead, Al.
I was just going to say, now these networking events, there are some smaller solo providers that go to those events like chiropractors and such, but for the most part, you're looking to partner up with other referral partners that are not necessarily even in healthcare, right? That's your goal?
Correct.
Yeah.
Correct. And Cynthia provided that. Like I have those pitches where you'll stand up and say, hey, they're not going to be doctors in the room, or the
Mhm.
chance of them being there is very slim.
Yeah.
But all of these are business people. They're in and out of offices. They belong to churches. They have neighbors. They have family members. Someone knows someone who's going to need the
Yeah,
services. So the pitch is for referral partners.
Yep. That's a very important distinction to make.
yeah, there you
Yeah.
go.
And you've already got a great one. You said you had a friend who's already been referring you, so maybe they can refer you to some more at some point.
Mhm.
Yeah.
Yeah, and I think everybody wants to get the phone number of your friend.
Nope. Nope. Don't
Can't
do
have
it.
that.
No.
Domenico is asking Cheryl, for your clients, what systems are you using? For example,
Um,
did the providers keep their existing systems, or are you leveraging ABS's system?
Right now, they want to keep their existing systems. It's eClinical Works. One is another one that's a much smaller known Thera platform. It's for the social worker client.
Mhm.
Um, they're aware that we have systems right now. They're okay with the system.
Yeah.
And I was okay with that because again, the systems they have are good. And right now, I just want to get in and prove my credibility and my
Yeah,
expertise. And then you never know if they'll be interested in moving to one of our products later. But right now, they're not interested.
that's fair.
That's what we're seeing more often. We've gone through years of the government, forcing doctors to go electronic and then forcing
Yeah,
them to get medical record systems. And there's a lot of doctors that have done a lot of software switching, throughout the years, and they're just like, you know what, we're going to stick with what we got. And so I want to make that point, for the people on the webinar here. You are not trying to force them into our system that we have. We actually have 3 different platforms that are really great, depending on, what the specialties and, what their needs are. But like you just said, if a doctor's like, I don't want to switch software, do you still want to do business with me? The answer is heck yes, I do.
yeah,
You
Yeah,
know?
yeah.
So why don't we go ahead and just get into, your how did you are you learning how to use other systems? Did you just hire some people to help or that already were familiar with those systems, or how did that work?
So well, they all knew the system. So my first hire, I found on Indeed, actually. I placed a very detailed job description on Indeed.
Hmm.
I have independent contractors. I'm not hiring employees just yet. So
Yeah.
um, she had great experience. I had over 300 people apply, so that was kind of
Whoa.
difficult.
Whoa.
Wow. Wow.
I
Okay.
think legitimately I looked at probably 100, but the systems make it really easy because you can scan for keywords, and I interviewed quite a bit. But once I got that one, I knew she was the one. The other came through a referral, and the other came through a search on LinkedIn. So it's not hard to find
Yeah.
builders.
Yeah.
You're just looking for the one that has what you're looking for. And so these specifically had this EMR experience. They specifically, even for me, not so much, this is probably getting off topic, the skills, because I believe that skills can be learned. You can teach skills. I was looking at more the character of the person because this is my livelihood. And
Yes.
I
Yes.
take the provider's livelihood serious. I take what happens with the patient serious. So I had a lot of ethical type questions during my interview process. I had a lot of scenarios that I wanted to hear how they would answer. And again, people can tell you what you want to hear, but I felt genuineness. I felt sincerity with the way that they elaborated on their answers. So to answer your question, it's not hard to find billers or coders or AR specialists or eligibility specialists. There's a lot of people who are looking for work. They're not our competition. They don't want to have a business. They just want to work for you and make a
Yeah.
living. So that part's
Yeah.
been easy.
That's another thing that it's hard to get across to some folks that join ABS. They think, oh, I need to learn everything myself and do all the work myself, and that wouldn't be me. I wouldn't want to be sitting in front of a computer doing billing all day. That wouldn't be me. So,
I've
and
never
that's
submitted a claim at all. Now,
wow.
I've never submitted one. Now, I understand it more because I'm running reports. I want to be efficient. So, and the system, the softwares, they make the report so easy for you. So you start recognizing, okay, which payers take a little bit longer to pay,
Right.
which payers want an authorization on everything that you do. You start to pick that up, but it's not required. You just need to hire well. As long as
Yeah.
you hire well, to me, I look at it, it's a business. So if I went out and found construction companies, I don't have to know about construction. I just need to hire people that do know about
Sure.
construction and
Hmm.
manage them well. So no, I've never submitted a claim. I looked at some things that needed to be appealed today and I thought, where could I do that? And then I thought, well, why would I do this? Why would I do that? So I am going to take a few like YouTube webinars and some of our learning videos just to become more familiar out of my own
Sure.
curiosity. But submitting a code is not a desire of mine. I want to build the business. I want to have billers, coders. Like I know how I want the business built out now that I'm actually in it. But it, and that could change. Maybe later on I would want to, but if you are in billing already, it's almost a no-brainer to me. Like if you're in billing, like if you've ever submitted a claim, like this is so easy, so easy. If I'm able to catch on literally in a few months and I've never even seen the back end, like I heard of EMRs, but I'd never seen one.
Right.
Yeah. Well, I
So, well,
love.
so
I was
go
going to
ahead.
say, I love how you are talking as the owner slash CEO of your
Mhm.
business. Many
Mhm.
times when I do our webinars, I try to get people to think, start thinking as a CEO right now. Don't think of yourself as a biller. Billing is the business.
Mhm.
It's just the every day thing and you may be the CEO slash the biller for in the beginning, but I think the people that are the most successful that I think we've come across, Adam and I and the rest of the group here, are people that understand that this is their business. They take pride in telling others about what they do. And if you don't tell people what you do, whether it's in a BNI meeting or a Chamber of Commerce meeting, people don't know that you're in business. That's just the bottom line. And I think, the more and more people kind of get that mindset, the better off and the quicker that they'll be successful. So kudos to you.
Yep. You got to think of yourself as the owner of the business. And that was another thing I was going to say earlier is with the people, the doctors that you were talking with, you made a point, I'm sure you made a point to tell them, look, I'm the owner of this business. I'm in your neighborhood. Like
Yeah.
we're in Atlanta. Like I'm going to give you my cell phone. If you have a problem, I'm going to fix it immediately. That speaks volumes over those
Mhm.
overseas companies, because they don't want to feel like another just random support ticket in some system somewhere, so
Yeah.
that's huge.
Exactly.
So
And
we got,
like they have my personal number. They have the business number, but they know they can call me on my personal number. And one, I really don't even hear from because I just stay in contact. I shoot them an email, let them know what's going on. I send them a monthly report. It's not hard.
yeah,
Yeah.
It's not hard at all.
yeah, that's huge though. That personal touch is
Mhm.
massive. So we got a couple of questions about like volume and what you're charging and stuff. So I don't, we don't need to get into revenue, but so Joshua is asking, how much is the payout with each client? Is this a monthly charge from your clients? How is the finance distributed to your hiring? So I guess the question would be, what are you charging your clients for the service? And do you have an idea on roughly what kind of volume they're doing, if you can think of that? And then I
Answer
guess
that
the other question would be how are you paying your contractors, I guess, if you
answer
want to.
that kind of generally. I don't want to be too specific,
No.
but one provider, their rate is a little, I don't want to say a little bit more, but it's one thing because we're doing front to back end revenue cycle. So we are calling, checking eligibility. We are performing the authorizations.
Mm.
We even when there's a surgery and there's an out-of-pocket cost, my team is even calling the patient to communicate the out-of-pocket costs. That's another selling point, that the reason why this doctor chose me. That way the patient is prepared several
Mhm.
weeks
Yeah.
in advance normally to make what that payment is. And it just makes their whole experience happy. This doctor said that they can do a good job with the clinical work, but if the financial part was communicated in the 12th hour or whatever hour, then that could make the whole experience be a negative one. So that's
Mhm.
one scale of payment, appeals and aged AR. Like there's aged AR sometimes for years back.
Yeah.
Then there's, a scale that I have where we're not conducting the eligibility checks, and the provider is actually taking care of that. We are submitting claims only and handling the appeals. And then that's going to vary based on the industry, whether it's chiropractic work, licensed clinical social workers, to a scale of it. It's an oncology, neurology, cardiology. All of that is going to determine your fee scale. I can tell you, you can get suggestions or some guidance when you're talking to our support team. They can help guide you on that, but a lot of that is actually online, and then you have to do
Yeah.
what's best for your company. With my staff, they're independent contractors, so there's no benefits or anything like that. And it depends on their role, and depends on the capacity that I'm going to use them. So you may have someone that you're just going to pay an hourly, not an hourly, a fee based on per patient, based on if they were doing an appeal, if they were doing the authorizations, versus I have someone who's a certified coder. She's a biller and a coder, and it's a much higher level of expertise. And so
Yeah.
that is a percentage based role. So I don't know if that answers the gentleman's question, but it kind of depends on, again, you may not even have any of that if you're performing the work yourself. If you're submitting the claims, if you're checking the eligibility, you won't have any of those payouts. So, and it's going to change per client. So you don't have a flat fee based on like, hey, I'm always going to charge 6%, regardless of the specialty, regardless of the volume. All of that you have to take into consideration based on what is needed for the role, which is why
Yeah.
you have to ask a lot of questions on what it is that provider needs, because you might agree to something and then find out oh my gosh, they have years and years worth of aged AR that you're going to be working on, or they don't have any at all. All that is going to
Yeah.
make a determination on what you want to charge, what is fair for you to be compensated, and what is fair to the provider. Like, you want them to be happy with what your rates are. A lot you can find online, and whatever you can't, support team has been able to help me a little bit with that as well.
Yeah, that was my next question. Has the ABS support team help you kind of navigate with your proposals and stuff? Figure that out?
Generally, because I had a few questions just about industries, earning potential. And again, a lot of that I researched on my own. And again, if you ask enough questions, sometimes the provider will tell you. Like, I've literally had a
Sure.
provider tell me what they were paying the previous biller. And then
Yeah.
you hear what all the previous biller was or was not doing, and you can adjust based on that.
Yeah.
I even have, just to give you like a little tip, I even have some incremental increases in my contract. Once I hit certain thresholds, my commission might be this, or if my thresholds are this, my commission is that.
There
And
you
my
go.
providers have loved that because they felt like that was fair. They understand I have incentivized myself to do a great job. And
Yeah.
so that may not even be needed for everyone else, because everyone's experience is different, but there's not a hard and fast rule on how much to charge. You're going to have to ask a lot of questions and see what's the best fit for you and the provider.
Yeah.
But just for straight billing, are you doing a percentage like 6% or 7% or something like that?
Yeah.
Yeah, that's the range. Typically, the range is around anywhere from 4 or 5 to 7 or 8%. That's what we see just for the new billing coming in.
Yeah, Joshua says thanks, and he did ask one other thing. So it just basically depends on the scope of work, and I think you answered all of that question there for sure.
Yes.
Good job.
Yeah, that's good stuff. So, yeah, Chad's asking, does ABS help determine the scale for new business owners? Yeah, absolutely. I mean, part of the process that we strongly recommend is, we teach you how to do the practice analysis that Cheryl mentioned, where you're asking a series of questions, usually done with the office manager, sometimes the doctor. But it basically is just an information gathering session. And then you provide that information to our support team, and we can make recommendations on what you should charge for this, that, and the other, what services you should offer, because you're never going to offer all 12 of our services to every doctor. That doesn't make any sense. You're going to really take a look at what their real problems are, and say, I recommend that you do this, this, and this, these 3 things, or whatever the case may be. So, yeah. And Joshua said, every scenario has a different scale. Understandable. So, yeah.
Carla is giving you a kudos here. You ought to hear what she has to say. Carla says, as a mom to a daughter with special needs and epilepsy, you are truly a powerhouse. I am so grateful you shared your story with us today. You're incredibly inspiring.
Thank you, Carla. Thank you so much. I appreciate that.
Yeah, Carla is a brand new licensee herself. Her and her husband have been building the business, and if they haven't got a client yet, I think they're super close. So,
Yeah, absolutely.
yeah.
Hey, Carla, I'm a phone call away. I mean, I feel like we support each other. So if you have any questions, I mean, I'm new in my journey, but I'm open.
There you go. So, just to reiterate, so your team is you, and who's under you?
3, a biller, one that specializes in billing and coding, one that specializes in eligibility and authorizations, and then one is concentrating on aged AR.
Okay.
Gotcha.
And so one of your clients, you discovered they had a bunch of old AR. Were you aware of it, or it was kind of a surprise?
Well, they knew that they had a lot, but not to the degree that it is. Like, the previous companies just were not working. I think they were submitting the claims they had. If one was rejected, they were just moving on week to week. They weren't going back because of the age. Most of it is not something that's so hard to fulfill. It's like, oh, they needed medical records. Or oh, this code had the wrong modifier. It's very simple fixes. It's a volume. There's a lot to do. And again, some of that is going to age out because some of it is well beyond like the timely filing. Look at me knowing this lingo, past the timely filing. But
like a pro.
it proved to me that there are a lot of companies who are just not committed to seeing everything fully through. They're just want,
Yep.
I don't want to say low hanging fruit, but just submitting claims. That's the easy work. They didn't want to take the time to go, if the payer said, no, we need this, and then just do this, and this. Like, I can't understand why you wouldn't. And even if you're working by yourself, when you look at how much more revenue could come in, you can afford to pay someone like me. I'm doing that on a part-time contractual basis.
Yeah.
Because I understand that what I'm paying there is a deposit on what is going to come in that's going to benefit me and benefit the provider. That makes such an impression on the provider when they've had all this basically money sitting on the table is what it means.
Yep. And then you work that old AR and the doctor's like, oh my gosh, free money coming in. Where's this coming from? That's awesome.
It's money that you earned.
Yeah, exactly. We had a question about someone wanted to know Medicare. What's the question?
Yeah.
The question is, how long is the timely filing for Medicare? I think that is the question.
Don't quote me, but Medicare or Medicaid is the longest. Again, I'm not a biller, so I don't know. So consult your.
I thought it was
one of those has a longer timely filing. It's like 18 months to 24 months versus
Medicare's long.
Yeah. And then all the other private insurances, they're all different, or are they typically a certain?
Yeah, they're all different.
Yeah, never know.
Well, as we're kind of getting wrapped up here, I've got one question for you. Share with the group here, kind of a closing thing here in a way, but obviously knowing that it's not a franchise, there's no franchise fees, there's no territories. What was was it impactful to know that once you had the opportunity to go through training, that you still had, you had the guarantee for 30 days? What kind of comfort did that bring to you?
I mean, that told me you stood behind your product. You stand behind your service, because most times you pay your fee. That's it. The fact that you said, okay, and you're going to finish your training well before 30 days. So it's not even like it's going to take you 29 days and you have 1 day to decide. No, again, I did my training in less than 2 weeks. And so you have time to decide, hey, this is for me or it's not for me. But the training is so good. I feel like you're not going to be questioning it at all. Like, it was a no-brainer for me from the beginning. I even saw like a demo of our products. Like, once I understood this is very user-friendly and the support team is here to help me. They don't want us to be unsuccessful. They want us to be successful. So I have had a great experience with tech support. I never once considered asking for my money back. Like, no, not any point during the training, after the training, on the 31st day, like at no time ever think, oh, this wasn't a good investment. No.
That's awesome.
If you want to give us more money, you can.
I know, right?
That'd be fine. No one ever takes me up on that offer. Dang. No, that's great. Yeah, I mean, we're almost out of time here. I don't see any other questions.
I don't either.
Any final thoughts, Cheryl, for people that are looking into this business and not having any idea if they should be doing it or not? I mean, any words of encouragement?
Yeah, I mean, just do your due diligence. I watched all of the videos online, because you're going to pick up bits and pieces from each of the licensees. And then again, this is a person, I had no medical billing experience. And everything happened kind of quickly for me, but I don't think anything about what I've done is special. Like, all I did was tell everybody, this is what I'm doing. I literally told everybody, this is what I'm doing. I followed up. I'm polite and I'm honest. I don't try to pretend like I've had a business for 5 years. I don't try to pretend that I know all the codes. I tell them, hey, I decided to take my time and talents into, my own business. And now I've hired the best billers, the best coders, the best compliance officers. Like, you're going to learn all of the words to say in your training. And if I don't have an answer, because sometimes they'll say, well, what's the CPT code for this procedure? You know what? I don't know, but give me a minute. I can find out and get that information back to you. Don't try to wing it. People respond to sincerity, and they respond to No, I'm busy with the business aspect of it.
Right.
I'm not submitting the codes. Now, if you can do that, that's great, but they respect that I'm honest about it and that I'm fair. And that, again, I promoted my customer service, and that's how I've gotten all of my clients.
Yeah,
Great.
you're the CEO. You don't do that stuff.
That's right.
There you go.
That's what I do. I hire people that are smarter than me. It makes more
That's right.
sense. Yeah. Well, Cheryl, thank you so much for being
Thank
on.
you.
Really appreciate it. We got a couple of people requesting your number. If you are an ABS owner, you can contact support. We can provide you with Cheryl's number. Sounds like she'd be happy to chat with you. So we can do that. Just email support. Thanks so much, Cheryl, for being on.
Y'all have a
Thanks,
good day.
Cheryl.
All
You
right.
too.
Have a good night.